Thyroid management in the current healthcare system is far from ideal. Millions of Americans suffer with thyroid-related symptoms, and unfortunately, they're being told by their healthcare practitioners that your labs look fine, or even worse, they're on medications and they're still suffering. Thyroid management from a functional practitioner that's not covered by your insurance is much more affordable than what you think, and in this video, you're going to learn and understand why the current healthcare system, aka the insurance covered system, is not going to get you where you need to go, and the thyroid plays such a major role for optimal health. Hi, my name is Dr. Jones, and I have clinics that service across the nation. And for the past 10 years, me and my medical practitioners have helped patients in bioidentical hormone management, but thyroid management in particular is the one that matters most, because even testosterone therapy, estrogen, and progesterone will not be as ideal, will not work as well if you have an underexpressed thyroid, if you don't have enough thyroid hormone, because they call it the master hormone for a reason. Every single cell in your body is impacted by the function of thyroid. Let's start by looking at this study. This study found that 13 million Americans are living with an undiagnosed thyroid condition. In conclusion, the correct diagnosis of thyroid dysfunction is extremely important due to the detrimental impacts of thyroid dysfunction on human health. Yada, 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 yada. So we have to understand every single cell in our body, and there's trillions of cells, each have receptors for thyroid. And that magical process that we know called the electron transport chain, which is existent in the mitochondria, which is the powerhouse of our cells. And we've heard about the mitochondria and how important the mitochondrial health is. And all this talk about NMN supplementation and getting all those cofactors up. At the end of the day, it's the expression from the thyroid hormone, the activation of those receptors, that actually drives that process. And so a lower level of thyroid hormone means that every single cell in the body will not function, will not have as much juice, will not have as much power as it ideally needs. So when you really look at that, you can understand and appreciate how much of an impact a hypothyroid situation can create. Just look at the amount of people through various forums and various outlets looking for answers. And we're going to get into this here, but there's reasons why the current healthcare system is failing so many people with regards to thyroid. It's just inadequacies due to how they're testing and how they're treating. And it ain't the doctor's fault. It's they're victim of the system and what insurance companies will cover and what insurance companies won't cover. Okay, so function of the thyroid. I like this chart here because it gives us a bit of an overview. Eyes, lungs, livers, reproductive system, digestive system, your brain, literally every cell in your body. I think that should paint a big enough picture, that should make it clear enough that any deviation from an optimal thyroid is having an impact over every single function in our body. So it's a very big deal. And we, like, even testosterone and sex hormones, as powerful as those are, don't affect every single aspect of your health. But guess what? The thyroid does. So we can't mess around with this, folks. We have to pay attention to the symptoms of low thyroid, so that we can understand that an issue might be going on and take responsibility and control in our own hands, because that's one of the main points I want to get across in this video, is that the current healthcare system is failing with regards to thyroid management, and you're going to have to be looking at this potential issue and doing something about it on your own. Love this graphic too as well, because it goes over the common symptoms of low thyroid. There's so many here, but here's the big ones. Here's the ones that I want you guys to quickly just kind of ask yourself, do I have half or more of these symptoms? Difficulty losing weight, brain fog, lower levels of energy. You feel more cold or you're intolerant to cold, hair loss, brittle skin and nails, this achiness, achy body, all right? These are the big ones, all right? And as you can see, there's many more. If you have half of these symptoms or more, like, that's a relatively accurate diagnosis that you likely have a hypothyroid symptom. Now, where it's coming from, why it's happening, we need to figure that out, and that needs to be discovered for the best possible approach. But just being able to identify it is a huge issue. And we're going to get into that here, why that is such a big deal. Okay, so why is the current healthcare system failing us? Well, they only check TSH. And so we're going to talk about the different lab values and what they mean and why they should be checked here in a bit. But starting with what is checked, right? So TSH, thyroid stimulating hormone, that's not even your thyroid hormone. This is a precursor. Your body has this powerful system. And when I remember back when I was in high school, when I'm taking my intro physiology classes, wondering like, why don't we just have one hormone that gets released, does the job? Why is there this hormone that tells this area to release it and when you get into it, you realize this gives the body versatility to have checks and balances and regulations, as intricate as it is, right? It's a very beautiful design, the body. So thyroid stimulating hormone is a hormone that is released by the pituitary gland that stimulates the thyroid gland to release thyroid hormone, right? And it's centers in the brain that then control the pituitary gland and tell it how much TSH to release. So standard health panels, insurance covered health panels, when it comes to thyroid, usually only cover TSH, and that's it. And look, I'm not saying we throw TSH out the window here. No, TSH is still if that's all we ever could have, it's like a large net that we're throwing out there and we're catching. I mean, I don't know, it's a guess, 60%, 70%, 50%. I mean, I wouldn't even know how you begin to guess, but a good chunk of people. But that 20, 30, 40%, whatever it is, of the people who are being told their TSH levels are good and still have symptoms, and we showed you guys the chart, and you guys see it here again of all the symptoms that tell us you might be hypothyroid, which are dramatically affecting the quality of your life, they're not getting treated. And not only do they feel like shit, but they're literally going to die sooner because they don't have the necessary thyroid hormone, which keeps everything else functioning at the level that it needs to function for optimal health. So this is a big deal, okay? So there are times where TSH does not do the thing that we expect it to do to indicate actual thyroid status. There's a certain relationship that there's no point of getting into for the sake of this video that give us relative accuracy. Okay, TSH is doing this, then we know thyroid is good. But for the people that we're talking about, they have issues. So additionally, we need to be looking at the actual thyroid hormones in your body. And so we have T4 and we have T3. So T4 is less active than T3. Again, beautiful design by the body. We have two different thyroid hormones. We have T4 and T3. And the majority of what your body makes is T4, a little bit of T3 that it makes. And what we rely on is the conversion of T4 into T3, okay? T3 is extremely metabolically active, 100 times more. You heard that right, 100 times more, hundreds times more active, metabolically speaking, than T4. Still some activity with T4, but the majority of the effect that we're looking for comes from T3. So your body relies on its own internal conversion, okay? And we're going to get into why that's important here in a bit. So when you look at lab values, you want to be looking at your actual levels of T4 and T3, and we want to see them in the optimal range. Now, the concept of free versus total, right? We want to look at both because the difference between the both less often, but could be issues. But again, we don't need to get into that. Free fraction, free T4 and free T3. This tells us the actual bioavailable amount of thyroid hormone that is floating around. And that's what's actually biologically active. The rest of it is bound to what we call binding globulins. And so free T3, free T4, very valuable for seeing the actual thyroid status. And then finally, there's a marker called reverse T3. Reverse T3, the marker that is even sometimes missed by traditional and holistic practitioners, is important to know because it's the very action of what we see on labs reverse T3 is doing, which could actually be the explanation of what's going on. Reverse T3 can actually attach to the receptors of thyroid and block your thyroid from doing what it needs to do. It's wild. Okay, so let's talk about, now that we have a better understanding of these labs, right? Let's talk about why they're important and why we see three different scenarios here. Okay, scenario number one, doctor says my labs look great, but my thyroid symptoms still persist. Let me know in the comments if that's you, because this is probably the most common one. The reason for this, and hopefully you can think with this now, your TSH looks fine. They didn't look at your free fraction hormones. Therefore, you were somebody who didn't get diagnosed based off standard insurance covered panels, and we would likely see lower levels of T4 and T3, and that's why you feel like shit, and that's why you have those symptoms, okay? So we need the free T3 and free T4 to accurately diagnose a patient like you, and then we can prescribe the proper medications for you. Okay, so scenario number 2, I'm on thyroid medication, but I still feel symptomatic. I still have these various symptoms. What's going on? The doctor says I'm on the right dose, but I don't feel good, okay? The number one prescribed thyroid medication, levothyroxine, is T4 only. We talked earlier about the difference between T4 and T3, right? Remember, T4 is converted into T3, happens into your body. The majority of T3, very little T3 itself is made. The majority is T4, and your body relies on its own internal conversion. Well, guess what? That conversion is an enzymatically driven process. And what newer literature now shows is due to inflammation and stress and many other issues, people are under converters. They're not converting enough of their T4 into T3. And so being on T4 medication, levothyroxine, for example, they still feel like they have the symptoms of hypothyroid, and they will until either you can fix that conversion issues, which is something that I would opt for, but unfortunately is a very expensive and tedious process, because now you got to work. It's essentially an overhaul of your health, working with a functional provider, trying to figure out why you're under converting. And this is, I mean, we help people on so many levels restoring optimal health, but sometimes it can get very, very nuanced. So in the short term, we prescribe medication that has T3 in it. And we're going to talk about our favorite one here in a bit. So under conversion, on medications, still feeling symptomatic. Finally, less common, but still an issue, you could be on a medication that has T3 in it, and the practitioner is looking at your doses, looking at your labs, dosing you appropriately with the right amount of T4 and T3. But if they're not looking at reverse T3, and reverse T3 is high, we talked about earlier what reverse T3 does. Reverse T3 binds, attaches to those thyroid receptors, essentially, in essence, inactivating your thyroid hormones. Like, thyroid hormones are still floating around, but they can't attach as well to the receptors. So AKA underexpression of thyroid, and we have the same symptoms. So reverse T3, I could do a whole separate video about it, but we know it's stress related. And so working with a clinic that can help you identify that and try to fix it, could be an infection. That's a common stressor, could be many other things. So we need a complete thyroid panel, right? You're working with a practitioner. You want to work with somebody who starts with a complete thyroid panel that includes free T4, includes free T3, TSH, reverse T3, and even thyroid antibodies, guys. We're going to talk for a couple minutes at the end about Hashimoto's and thyroid autoimmunity. The number one autoimmunity disease that we have is Hashimoto's, that we're aware of. And so I'll do separate videos where I take a much deeper dive on that. So with the solution, with the proper labs and the proper diagnosis, hopefully you're working with a practitioner that understands how to approach this. If they're doing the right test, they probably know what they're doing. That's number one. And, you know, my female women's health practitioners have been doing this for the past 10 years, and it's just amazing. Even on just thyroid alone, what we've seen happen. But when we put it all together, thyroid, testosterone, estrogen, progesterone, or just thyroid, testosterone for a man if they need both, my gosh, talk about restoring quality of life, alleviating those symptoms, which we combine with proper lifestyle choices. It makes all the difference. Okay, so I want to talk a little bit about Hashimoto's before we end off. So Hashimoto's is a autoimmune disease. So what is autoimmunity? Autoimmunity is a situation, a condition, if you will, caused by many factors: genetic, environmental, stress, probably toxicity. And it's like a switch. It's a switch in the body. Once turned on, difficult to turn off. And what's happening is your immune system is targeting certain tissues for destruction, targeting it with antibodies. And when certain stressors triggered and kick in, there's some destruction that actually takes place. So the end goal for Hashimoto's, because this is an autoimmune disease affecting the thyroid gland, is at the end of untreated Hashimoto's, we have complete destruction of the thyroid gland. And there's not a lot conventional medicine can do for Hashimoto's. There's not a lot that conventional medicine can do for basically all autoimmune issues and all autoimmune diseases. And like I said, I'll do separate videos talking about Hashimoto's and autoimmunity, but the test is so important. Your practitioner, if you're getting thyroid management, if you've never looked at TPO or TG, thyroid peroxidase or thyroid globulin antibodies, then you don't know if you have potential either Hashimoto's or just the fact that you have sort of an early onset in development, because we know it's a problem if we see those slightly elevated, okay, potentially. So ensuring that you are looking for that, and then God forbid you do have it, then there needs to be some additional effort on your part to mitigate that. And there's a lot, like I said, there's a lot of lifestyle that goes into handling autoimmunity. But one aid that I love what we do is called low dose naltrexone, and I'll make separate videos about that. But low dose naltrexone is so awesome for autoimmune issues. It's a very, very low cost medication. Naltrexone itself was FDA approved for recovering alcoholics and drug addicts, but low dose is this very popular concept in the anti-aging space where we use a much lower percentage, usually like 10% or 15% of the standard doses. So it's very, very safe, very well tolerated. It does two powerful things for autoimmune patients that we love: strongly reduces inflammation, and it strongly calms down, modulates that immune system, right? So it gives autoimmune patients an edge that they need in order to then implement better lifestyle choices and get a better result. So if you are Hashimoto or any other autoimmune disease, definitely LDN could be a game changer for you. In addition to some proper lifestyle choices, we got to reduce our inflammation. We have to manage our stress. We want to address micronutrient deficiencies. We want to become more insulin sensitive, reduce insulin resistance. And we want to optimize our sleep, guys. These are all the pillars for optimal health. And this is what we do with our patients, whether it's thyroid management, weight loss, or hormones, whatever it is. A protocol that encompasses science, but still focuses on coaching these lifestyle choices are what we specialize in, and what I think is the best way to approach healthcare. If you guys enjoyed this video, if you want to learn more, maybe you want to access us and schedule a consultation, in the description, there'll be a link where you guys can reach out to us, access some really cool free guides on weight loss. But definitely check out this video, GLP-1 Realities. I was interviewed regarding our successful weight loss program, and we take a deep dive into many, many aspects of why we have such a high level of success. I'll see you guys later.